Well, in addition to Pinellas County, another place in the area that is getting the vaccine is Tampa General Hospital. It's one of 5 hospitals in Florida that's participating in the state's pilot program for the distribution of the coronavirus vaccine. This morning, the first person got the vaccine in Florida. It was a nurse, and it's Vanessa Arroyo was able to get the vaccine less than an hour ago, and we saw that on television. And joining us right now for the perspective about what's going to happen at Tampa General Hospital is Dr. Jason Wilson. He's the medical director of the Clinical Decision Unit at Tampa General. Welcome back to WMNF's Midpoint, Dr. Wilson.
Hey, Seán, it's good to be back.
Thanks so much. And I know we just had you on, but this is a new perspective here with the vaccine. The vaccine is in the house, as they say. It's at Tampa General. It's being stored at -70 Celsius. So what I want to ask to begin with is, who will be the first people that will be getting this vaccine from Tampa General?
Yeah, about 2 to 3 weeks ago, we began to seriously identify frontline staff who would be eligible to receive the first wave of the vaccine. And so that meant thinking about the people who see COVID patients the most. And that includes our emergency department staff, our ICU staff, and the team of people, of course, in the COVID unit, which is now called the JEDI, the Global Emergency Disease Institute. And so thinking about all those people, the doctors, the nurses, the respiratory therapists, the pharmacists, other staff members who interact in those areas, those were identified as our highest priority first wave of individuals who should receive vaccine. And from there, we started to think about how to get to those individuals and ask them if they'd like to receive the vaccine. And over the past week, we've been doing exactly that, reaching out to those folks and asking if they'd like to receive the vaccine. And even now this weekend, starting to schedule them for vaccination.
And I guess one of your bosses, the president of Tampa General Hospital, said at that press conference, he said that Tampa General now has 20,000 doses of hope. Because this has been a really bleak year. And now that the vaccine, it might not be a panacea, it might not happen right away, but at least I think people are beginning to have some sort of hope that there is a vaccine, that it's being distributed. What are your thoughts on what he said, how he called that?
Yeah, if you go back a year from now, we still didn't even know this disease, this virus existed. And to be sitting here, after a really long, hard year, to have, seen as much, death and destruction as we've seen from this pandemic, totally change our healthcare system, our economy, our lives. But then to be sitting here and talking about a vaccine in hand within a year, less than a year, is amazing. It's a moon level breakthrough level of science. And I would really say the mood was as happy as I've seen it this weekend among the frontline staff, knowing that the vaccine was coming. It's been a pretty exhilarating experience, I would say, to know that's there. There's some hope here for both us and our patients. And when I say, hope for us, it's, hope to be able to take care of these patients safely in this community and to be able to keep on treating people with COVID safely. But then knowing also that some of our patients who are sick, we're going to be able to, vaccinate those types of patients here in the future.
And it won't be just frontline workers at Tampa General that will be getting these first immunizations, is my understanding. You're also shipping it to other local hospitals?
Yeah, that's my understanding. Actually, as we're chatting, news is changing all the time here, Seán. And but that's my understanding here. I'm actually sitting here talking with Tampa General a little bit about that. And so I don't have a lot of details about that, but I'm learning that right now that we are going to be sending this around to some other hospitals. And we have those 20,000 doses that John Corus talked about, but we may be moving some of that around to places that need it throughout the Tampa Bay area.
And those 20,000 doses, people might think, okay, well, that's enough for 10,000 people to get inoculated the 2 times that you need it. But what they're specifically doing, it sounds like, is they want to get 20,000 people inoculated, and then they'll send more in time for them to get the second shot. What is it, in about 3 weeks?
Yeah, so the CDC has been pretty clear about that on the phone calls I've been on, that it's okay to go ahead and try to use what you have available to get as much vaccination out there as possible. And then we've got 3 more weeks here to worry about getting the next round of supply for that second dose that's required.
We're speaking with Dr. Jason Wilson, Medical Director of the Clinical Decision Unit at Tampa General Hospital, and this is WMNF's Midpoint Monday at 12:22 in the afternoon. So right now, if you're just a member of the public and you're concerned, you'd like to get this vaccine, there's really not anything that's available to you right away. But if you are in a high risk group, is there a way that you can kind of uh, think about the future and reserving a spot in line for the vaccine once it does become available?
Yeah, so what's going to happen is local healthcare leaders, and you saw Yuli Cho just say this too a moment ago, but the local healthcare leaders and public health experts will begin to think about how much vaccine we have available, how much more is coming as things stabilize a little bit. How do we get past that 1A, 1B, 1C phase the CDC guidelines have issued? And how do we move vaccines safely throughout the community? First, emphasizing really the frontline healthcare workers and then long term care facility residents. The other thing you're going to see here in the next couple of weeks is other vaccines start to come into the emergency use authorization market as well, I think. And that's going to start to help things really start to spread around and move throughout the community as quickly as possible. And I should say, no one wants to restrict vaccine. Look, we all have the same goal in mind right now, and that's to get everyone vaccinated as quickly as possible. Just recognizing that we've got to do, these vaccines for the most high risk patients and healthcare workers first. And so, in terms of getting information to your healthcare provider or reserving a spot, there's not a formal way quite yet or a systematic way quite yet to reserve a spot. But as long as you're seeing a healthcare provider, they're going to understand that information, and at some point they'll be contacted or have a way to kind of start to take their patients and move them into the system for vaccination.
Do we have an idea of about how long that might be?
I don't yet. This is really we're seeing today the first vaccine, come into the area. But what you can start to kind of play the cards out and look at the dominoes is that the Moderna vaccine is right behind the Pfizer vaccine. So they submitted their information to the FDA about a week after the Pfizer company submitted their information, and so you'd expect that the FDA would again meet with the Vaccines and Biologic Committee, that the CDC's ACIP committee would again meet, and you'd probably see recommendations for that Moderna vaccine to start to move through as well. That's a very similar vaccine that the Pfizer vaccine looks like. And so, as more of these vaccines move into the market under emergency use authorizations, you're going to see the ramp up happen more quickly. I think you can kind of think about frontline healthcare workers during this holiday period, moving into January, long term care facilities starting to be vaccinated as well over these next week or so. And then as we get into the new year, hopefully start to see this vaccine move into vulnerable patient populations as well.
And the governor seemed to indicate that the Moderna vaccine might be about 1 week behind, as you said. So it might even get that preliminary approval by the weekend and start to ship, and we might see it next week, as soon as next week. I mean, it's speculation at this point. We don't know for sure what's going to happen.
Yeah, my sense is this feeling of urgency and speed that we've had since Friday. I would, after the EUA, is going to continue on, through the winter months. Basically, you're going to see more vaccines moving like this into market. You're going to see some of the vaccines move from emergency use authorization to full approval. Remember, the Pfizer company now has their entire phase 3 study completed, and I've advocated for that for the beginning of this quest for vaccines. Is that we should still see completion of phase 3 studies, and we should demand to see that data for those phase 3 studies to make sure that it matches the interim analyses that are done that can sometimes lead to these emergency use authorizations. So Pfizer's provided that now, and what's very reassuring is that data looks very good. That data doesn't change anything from the halfway point. It still looks very good, and so you're going to see this whole game changing rapidly as we keep on moving through, and more and more people will come online who are eligible to receive this vaccine, able to receive this vaccine, given the supplies logistics that we have.
Our guest is Dr. Jason Wilson, Medical Director of the Clinical Decision Unit at Tampa General Hospital. TGH just received vaccines today, or maybe it was yesterday, but just started distributing them today. The first shots happened about an hour ago. And let's shift briefly from the vaccine itself to the pandemic. And there have been more than 20,000 deaths in Florida, more than 1.1 million positive coronavirus cases in the US. The numbers are worse, even 16 million infections, nearly 300,000 deaths. Tell us about how the Tampa Bay area is trending right now. In fact, as an aside, I just spoke to our general manager here, and he said he drove by a testing site on 22nd Avenue, is it 22nd Street North in Tampa, and the line is, he said, something like 5 blocks long to get tested. So what do we know right now about the infection rates, hospital capacities in the Tampa Bay area?
Yeah, I can tell you that what we're definitely seeing right now is exactly what we predicted from the Thanksgiving holiday. And, this is something I think that's important is that for the most part, all the predictions public health experts have made about what's going to happen with this vaccine, with this virus, have come to play. And that's unfortunate, but it's reality. And it's just an echoing that we have to understand the data that public health experts are looking at and making recommendations based on is the best available data that we have. And we've got to think about following those recommendations if we want to get through this pandemic. Even as we roll out a vaccine, we still have a ways to go to get enough people vaccinated. And that means we're going to have to follow public health strategies. And so what we're seeing right now is that the Thanksgiving holiday has brought on a number of new cases. And specifically, and unfortunately, what we're specifically seeing in the hospital setting are older, vulnerable people who are exposed during the Thanksgiving holiday by their family and are now sick with COVID. We have a number of those types of cases in this area. And the lines you're seeing at the testing sites are people who are recognizing that there was a family member who was sick at Thanksgiving and they were all exposed to COVID. And now they're out to get tested because of that exposure. Fortunately, the county did bring online a couple more testing sites. My understanding also from just talking to patients is that the turnaround times have drastically dropped for testing, and the county testing sites are really, as competitive as some of the private, for pay, consumer testing sites that you're seeing out there. And so this is giving at least, where we've known we need to go since at least last March and April, which is widely available, more rapid testing for the public. While there are lines, that's unfortunate. We are getting close to the fact at least there's access to some type of rapid testing for people. I have heard some pretty positive stories of people going to get tested and having results, within the next couple of hours, if not even sooner. And so that's exactly what we want to see. And hopefully, as these other sites come online, those lines will go down a little bit as well. But that's what we're seeing is a kind of a bounce after the holidays.
Since we're talking about testing, why don't we, if you don't mind, can you lay out the three different types of tests that are available? I think there are three broad categories, what the differences are and what each of them would tell you. So if people are going to get tested, they might be confused about which one they should
Yeah.
get.
No, that's a great question. And so when you think about it in terms of testing for the virus itself, so testing the virus is a RNA virus, and you're gonna hear the word RNA a lot because a lot of the vaccines are RNA vaccines or mRNA vaccines, and the virus is an RNA virus. And one of the types of tests we have, sort of the gold standard type of test we have, is what's called a PCR viral test, and that test actually tries to look for a very small amount of viral fragment, actual virus, and then we kind of replicate it in a machine to amplify it up so we can see that signal more easily. And that's called PCR, polymerase chain reaction. And that's the most sensitive test that we have. And that's the one where we think about traditionally the swab that goes way back in the back of the nasopharynx, sort of makes you sneeze or makes your eyes burn a little bit. There are some other ways to get at PCR testing now that have come online since the pandemic started. There are some saliva-based PCR testing. We're seeing those used a lot in athletics and other types of events where we need to make sure people are negative with the PCR test. And then also with some of the PCR testing now, there is the availability to use some less invasive nasopharyngeal swabs. Then the other type of testing that is also for whether you have a virus right now is antigen testing. Now, that doesn't look at actual genetic sequences of the virus, but it looks for evidence of antigen on the outside of the virus, a protein on the outside of the viral particle. The advantage of the antigen testing is that you can do it more rapidly, and you can also do it a little less invasively as well. Sometimes you can do those antigen tests with just the nasal swab. And so both the PCR and the antigen testing both look for a evidence of an acute infection, meaning I have COVID right now. Now, the other type of testing we hear about is a little bit different. That's antibody testing. Antibody testing looks for evidence of whether I did have COVID. It turns out that about 10 days after you've had COVID or symptoms of COVID, most people, over 95% of people, will mount antibodies. They'll have presence of antibodies. And so then you go get an antibody test and you can see those antibodies.
So those are the types of tests. And once someone gets tested, if they get a positive test, then people, hopefully, people will be contact tracing the contacts of those people. How is Florida doing when it comes to contact tracing?
Yeah, so what I'm hearing from patients actually is much more reassuring than what I was hearing in June and July. In June and July, it was a situation where it was virtually impossible because of the sheer just volumes of people who had COVID, and B, not really that meaningful from a public health standpoint. Meaning, if you've got a high enough prevalence of disease in the population, then essentially everyone is a contact. And so think about a common cold virus. I wouldn't do contact tracing with the common cold virus because both you and I are essentially contacts. We know someone right now with the common cold. It's that endemic in our society. However, once we can bring the overall numbers down a little bit, the positivity numbers down a little bit, and get a little control of these things, then contact tracing becomes much more useful because we could do some containment strategies around contact tracing. And the state, to their credit, did hire quite a number of contact tracers at the end of the summer, and that with coupling that with stabilization of our numbers thanks to masks and the rollback of the bars in the midsummer, the contact tracing has improved. So I have heard from patients now, which is different than I was hearing this summer, that they were contacted by somebody from the Department of Health, and I know that they're working with businesses and employers as well to do some contact tracing.
Our guest is Dr. Jason Wilson. He's medical director of the Clinical Decision Unit at Tampa General Hospital, and this is WMNF 88.5 FM. I'm Seán Kinane, and you're listening to Midpoint Monday at 12:34 in the afternoon. I'm going to turn back to the vaccines. Just a reminder to people that today, the first of healthcare workers in Florida are getting the vaccine, the Pfizer vaccine for coronavirus, and that's happening at Tampa General Hospital. What can you say about healthcare workers? I think it might be self-explanatory why they're among the first to get it. But for example, I was told that I read on fiercehealthcare.com that in September, a nurses union reported that more than 1,700 U.S. healthcare workers had died from COVID-19. Why is it that they're so vulnerable? I mean, besides the fact that they're just in contact more with these patients.
Sure. So, not so A, of course, what you just said, healthcare workers are in contact with these patients all of the time. And so when we go into patient rooms, we're wearing PPE, we're gowning up and donning on all of our equipment to go into those rooms. Early in this pandemic, in some areas, there was a limitation in the amount of PPE that was available. Fortunately, in this area, things have been okay. We had a little period of time where we were conservative about our PP that we had available just because we were concerned about supply lines. But that's really improved. We've had an adequate amount of PP. But you have to remember too, not only we're exposing ourselves while we're in the patient room, we're around each other at the workplace, often in close quarters. And so there's, a potential that if you were exposed to a patient in the workplace setting while you're close together, even though you're wearing a mask, over a long period of time, in that workplace setting, of course, you do worry about easy transmission, easy spread. And then, of course, it's not surprising that people who work in a workplace, see each other often. And so, in the community, we've seen spread of healthcare workers to healthcare workers. So these are all reasons, just in a specific kind of, workplace scenario as we might see spread there. But I think also more to that is that I think we need some hope for our healthcare workers who've been seeing the devastation and of treating COVID patients or this pandemic on people's lives, for 8 months now. And, I think when you think about, we had an emergency medicine physician in the state of New York who was sort of at the peak of her career, and a medical director of a busy, emergency department who committed suicide in the middle of this pandemic because she saw so much death. And I think just the knowing and the knowledge of having a vaccine and being able to get a vaccine really relieves a lot of fear, at least for people who are taking care of patients with COVID, and just sort of gives them some hope and some ability to help us push through these hopefully last few months of a really dark before the dawn. And so I think that's part of it. And I think also just for the public to know that we're comfortable getting this vaccine is also very helpful. And so I think it's great to see your, frontline healthcare workers lining up and see as excited we are. It should tell the public something about how devastating we actually think this virus is, how scared of this virus we still are, and B, that we're comfortable with the science and comfortable with the vaccine safety.
The images that people might be seeing today of healthcare workers getting inoculated, I think that might be reassuring to people and help them to make that decision.
Yeah, I hope so. And it's there's a lot to follow, I know, in terms of the science behind these vaccines, and things have moved very quickly. And I know there's a lot of disinformation and misinformation out there. But overall, I can tell you that these vaccines were studied, the Pfizer vaccine specifically, because I've seen the full, phase 3 data set now. And these were studied the same way any other clinical trial would be done, any other vaccine type of study would be done. And now you've gone through, multiple independent experts looking at this information from the FDA and the CDC, and really everybody agreeing that this is appears to be a safe vaccine, and appears to be a very efficacious vaccine in ways that we haven't seen before for vaccine efficacy. And so much so that the risk of COVID outweighs the risk of vaccine so much. It's like driving on I-4 without a seatbelt compared to flying in a commercial, airliner.
Our guest is Dr. Jason Wilson. He's medical director of the clinical decision unit at Tampa General Hospital. Recently, you posted a New York Times article about the FDA granting emergency authorization of an antibody treatment. You added, we now have 2 outpatient antibody infusion treatment options at Tampa General, 2 brands of anti-spike monoclonal antibody for patients with mild, moderate disease outside of a hospital setting. Complicated but promising is what you wrote. What is antibody treatment and how effective is it?
Yeah, great question. So these antibody treatments have been exciting to for us to see. It's given us the ability to treat patients who don't need to be in the hospital, and that's the first time throughout this outbreak that we've had some type of therapeutic for people who are not severely ill with COVID. Our other treatment options for patients so far have been for people who require oxygen and need to be in the hospital for treatment. But these monoclonal antibodies, which are basically very similar to the types of antibodies you would mount from a vaccine or that you would mount on your own, except they're synthetic essentially, and they're derived to specifically attack things like the spike protein. We can give those antibodies in an infusion to go after spike protein. And what we've seen from those already, as we give those to patients in our outpatient clinic settings, is a decrease in the returns to the hospital, a decrease in hospitalizations, which is exactly what was shown in the data from both the Eli Lilly company and the Regeneron company. The Regeneron company uses a mixture of 2 different antibodies. We call it a cocktail, antibody cocktail, and the Eli Lilly one uses 1 antibody. I don't know if there's a difference yet in terms of which one of those is better, but they both seem to be decreased number of patients who have to come back from the hospital. Anecdotally, patients, have told me that they feel much better the next day after receiving these vaccines. I'm sorry, these monoclonal antibodies. Now, the only thing with these monoclonal antibodies, they're not for everyone. The way they're designed right now is that they're for higher risk patients who are leaving the emergency department or being seen as an outpatient. And so essentially, you need to probably be a little bit older to really get benefit from these antibodies, or have a number of risk factors, things like high blood pressure and diabetes, or having obesity, or other immunocompromised. And those are the patients we're trying to get these antibodies to as quickly as possible. Another thing too is your symptoms for COVID had to start in the last 10 days. So I will say, just like I tell the public that if you're having a stroke, you should come into the hospital as quickly as possible. If you're having a heart attack, you should come in as quickly as possible. If you do have COVID or think you have COVID, you should get tested as quickly as possible, and talk with your healthcare provider about that if you are symptomatic and have risk factors, and they could perhaps help you get aligned with antibody treatment.
Our guest is Dr. Jason Wilson, medical director of the clinical decision unit at Tampa General Hospital. We'll have him on for another 3 or 4 minutes, but would you like to take a question from a listener? Is that all right with you?
Yeah, of course. No
All right,
problem,
let's do
Sean.
that. Why don't we take a call from Dylan in Lutz? Hi, Dylan. You're on the air. What would you like to say?
Well, excuse me. We're being asked to trust the FDA and the pharmaceutical companies begging for approval. But what we have to look at is that clinical trials are done by the drug company, Fox guarding the chicken coop, for instance. The FDA is supposed to regulate the pharma industry, but the FDA is actually paid by the pharmaceutical industries to regulate. So pharma runs the trials, then we're told to trust the findings of those. And there's a lot of good evidence that that's just not true. Dr. Stephen Wizen of the
Clay, hold on. I'm going to have the doctor answer, but thank you. That's a good question. I appreciate that. So why should we trust the drug companies when they say that they're safe?
I think it's a very fair question. And so let me walk through a little bit. You're right that this is a sponsored trial by a pharmaceutical company. And I will say, even when we have sponsored trials from pharmaceutical companies, the FDA does give them guidelines for what they're going to want to see for approval. And so there is some work together that happens between the FDA and a pharmaceutical company when a trial like this happens. One thing I will say is that there were no studies done by the drug company that were not published or not moving towards transparent data being available, which is not always the case. There are other drugs that either come to market or never make it to market, where we have trials that were called negative trials and we never get to see those. But we have a positive trial here with data available to everybody to look at, and it's the only really trial that's been done. It's still ongoing. That's a reassuring sign. You don't have like 5 negative studies here before this comes. The other thing about the FDA as well is, while you're right that there is some relationships between the FDA and the drug companies, they also have a number of independent bodies that do work on their, that sort of keeps them transparent. And so the Vaccines and Biologics Committee is really a group of experts who may not be employed by the FDA, but may be academics and other public health experts at different places who do peer review for journals, who do studies of their own, who have really deep expertise in this area. And so you've seen it go, this set of data go through those groups already. In addition, the CDC's looked at this data themselves as well. They've issued their own opinion just yesterday. On Sunday, they issued their own opinion about the data, and that seems to agree. They could have disagreed if they wanted to. I would say something this public and this with the data being this transparent and available, it does help us relieve some of those concerns. But you're right, and I've advocated from the beginning that I wanted to at least see the phase 3 trial go to completion and have the data remain transparent. In addition, having the FDA act independently of other branches of the government was also important. They need to be able to do the job they normally do, keep the same processes they normally take to review data. And I think, fortunately, maybe some shifts in the political climate, they were able to do that, and were able to take a look at this data and take their time and issue a vote that I think is a fair vote.
Well, Dr. Jason Wilson, thanks so much. But before I let you go, is there anything else that you would like people to know about the coronavirus in Tampa Bay, about the new vaccine, anything that people should know about?
Yeah, the vaccine coming is very exciting, and you're going to have a chance to get the vaccine very soon. I'm getting mine tomorrow afternoon. I'm very excited about that. But as we do this and as we ramp up the vaccine distribution throughout this area, it's going to be critically important that we still continue to do those same public health interventions we have to do, which include wearing a mask, washing our hands, and staying distance and staying out of crowded indoor spaces. It's even more critical now because we're so close to the finish line, but it's going to take a while to ramp up the number of people we need to get vaccinated.